want to welcome you once again to the Spirit Center channel on YouTube. I am Dr. K. Llewellyn McGee, the founder and world director of the American Community Chaplain Corps. In this particular video, we're going to talk about postventive spiritual care. And postventive spiritual care is really simply long-term care and concepts that you must understand before you can do long-term spiritual care. As with each phase of training that you're looking at possibly going through, there are three courses that make up this this training. In postventive spiritual care, again, you have three courses to complete the entire three phases of training and be certified. It's really 9 courses. When we talk about postventive spiritual care, you're really talking about taking care of people across the continuum of care. From the time you start, even if you have a client or a patient where they have a baby and that baby is born, you're taking care of that family all the way until you die or that baby dies. So the lifespan of that baby, really you're talking about care, in-home care for them across their whole continuum of care. So we have 3 phases that we're going to talk about in 3 courses within each phase, and so that's the point of this video. In postventive spiritual care, the first course is long-term spiritual care, where you understand all that's necessary to provide care to an individual or to a family or to a unit or to a church, so forth and so on. The assignment that is a part of this course is a 3-page reflection paper simply on the concepts of postventive spiritual care or long-term spiritual care, and we've talked about a lot of that already. Again, you can go to our website, www.thespiritcenter.org, go to the School of Chaplaincy tab, and then register online and ask any questions you want, and then we can send you out the whole training packet to you, and the administrator, the executive administrator, will do that. The second course in this particular phase of training is Gerontology, and that is the study of aging and the aged. Most people don't know that the suicide rate is highest in elderly adults, and many times they are not able to be social. They're getting old, they can't get out, and so our care to them is crucial. So understand some of their challenges as older adults. I think about one particular company called Home Instead. They're the largest senior care non-medical organization in the world. And so we're doing this, but we are providing specialized care to seniors, and we know how to do that in long-term care. The assignment that you need to do, along with understanding all the nuances and challenges of the elderly, is to write a 3-page spiritual care plan on an older adult. And then you ought to be as thorough as possible. And I'm sure you know someone who you can write a spiritual care plan, and basically you would do an assessment. Again, we will explain all of this either on the video or the manual or the CD, and you would kind of chart a long-term plan for their life after you do the evaluation or the examination for them. And the last course that is the final course in our training curriculum is administration, the heart of community chaplaincy. Why is it that I call this the most important course in the whole curriculum? is because people really want to know that you care. And the only way that you can know that you are following up with them, knowing that you're remembering those important dates that are sacred and meaningful to them, is really have your administration down. I've gone to seminary, been in seminary work, doing seminary work for 6 years, and there was not a course that dealt with how you properly kept records on people. Again, the whole training curriculum that I have is built on a medical model, in that you have health records or client records or member records, but you're following up and you're remembering those very important dates. You're remembering they're still married, their wedding date, even if they're not married, but maybe the person died. Those dates are important. You're remembering their birthday. You're remembering special events that happened in their life, positive and negative, good and bad. And you're helping them, walking them, coaching them, mentoring them, caring for them throughout their whole life cycle. We care for people who know we care. That's the motto of the core, or AC3. So these 3 courses, Pneumatology, 301, Gerontology, and Administration, are vital to provide long-term care. Again, I stated that this training is very unique but specific to community chaplaincy. Once you finish and come to the point of graduation, we have an association called AC3, by which you can become a part of this core, and we will help you really find jobs really all over the country and all over the world, because people need this. I've not seen training like this anywhere in the world. I've gone through lots of training, to include getting a doctorate. So we want you to tell your friends and family, those who may want to become part of this American Community Chaplain Corps. Don't think about the education level. We provide all the education in the manuals and the CDs and the DVDs that we provide for you. We've stated the cost for that. Again, the tuition is $225 per phase, and the total cost for tuition is $675. There's $125 for materials, which you get a 8.5 by 11 binder, along with CDs 11, and you get 3 DVDs. You have enough to be the best chaplain ever. Sometimes the people don't get a chance to go to seminary or work on a doctorate. Well, believe me, I've taken all of the training that I had, and some I did not have, some that I created, and I'm giving it to you in this package. This is a great means for you to do ministry, a great means for you to have your private practice of chaplaincy, and really to be accountable, because we have a system of accountability to make sure that we're caring for people. And we're going to start this process by caring for those who are becoming chaplains. And when you finish the course, we're not just going to send you off like schools are doing. We don't keep record of you. That's part of the uniqueness of our training, is we keep up with you, we care for you, and we model for you the care that you should be modeling and giving to your clients, your patients, and the members who you're taking care of. So again, my name is Dr. K. Llewellyn McGee. I am the founder and world director of the American Community Chaplain Corps, which is a division and association of the Pneuma Center, or the Spirit Center. We ask you have any questions, to go to our website, www.thespiritcenter.org. Go to the School of Chaplaincy tab, and then go to register online by simply giving your particular question, and we will get back with you. Thank you again for your time and attention in this very critical matter of providing care to